This is a federally funded project by HRSA housed at the University of Kansas Medical Center. Resource centers are located throughout the nation. There are 12 regional resource centers with 2 national telehealth resource centers that serve for technology and for policy. You can see those 2 national resource centers at the bottom left of this slide. Each of these telehealth resource centers serve as focal points for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. And we do that in a variety of ways, by online resources, webinars such as this, summits, workshops, presentations, staff training, and peer-to-peer connections, as well as some consults. Our speakers have nothing to disclose, and the committee members have nothing to disclose. Credit will be given to physicians and APRN and nurses. All other disciplines may receive a certificate of attendance. Each session is an hour long, and you would receive 1 credit for this session today. It's very important that you log on with your full name so that you may be identified with the email provided on the registration form, and you will need to complete an evaluation in order to get your credit. All right, a little bit more about today's speakers. I'm excited to introduce you to Maggie Murray and Eve-Lynn Nelson. Maggie is a registered dietitian and study coordinator on the NIH-funded research study through the University of Kansas Medical Center. Her research focuses on building healthy behaviors in children in rural parts of Kansas through technology. Maggie is interested in promoting and establishing dietary, physical activity, and behavioral knowledge and skills in underserved populations. Next, Eve-Lynn Nelson is our second presenter as well, and she is no stranger to the webinar series, having presented in February. She is the statewide director of the Kansas Telebehavioral Health Network and PI for the Heartland Telehealth Resource Center. She is a co-investigator on the NIH-funded iAmHealthy program, and she enjoys teaching about telehealth and outreach as a professor in the KU Department of Pediatrics. She has the privilege to provide telehealth services in Kansas for almost 20 years. So sit back and enjoy what Maggie and Eve-Lynn have to share with you. Maggie, I am going to stop sharing my screen so that you may share your PowerPoint, and we'll get started.
All right. So my name is Maggie Murray, and Eve-Lynn and I are going to be sharing the mic a little bit. So Eve-Lynn, if you would like to go ahead and get started, I will advance your slide. Eve-Lynn, I think that you're muted.
Thanks, Maggie. We wanted to start off giving a brief context of putting iAmHealthy in relation to other Kansas healthy lifestyle approaches over telehealth. And then Maggie's really the star of the show, talking us through some of the iAmHealthy telehealth approaches, really across a couple of different technologies, and then finally discussing some of the implementation lessons learned. So just to put this research in context, it's really a lofty goal. We really are hoping, regardless of geography, to deliver our very best healthy lifestyle interventions to children and families across Kansas. It really builds on Dr. Ann Davis's program of research, where for many years she's looked at innovative ways to deliver healthy lifestyle interventions across the state. Her early work, of course, focused on delivering those interventions at school-based sites, And what you'll hear today is the next step with that research, looking at delivering services right to the child and family's home. We see that telehealth has really helped address some of the social determinants of health with addressing some of the transportation barriers for coming into care. But I think what we've seen is that it really can help with some of the other social determinants and really making that family feel comfortable and confident in connecting with the iAmHealthy groups and individual health coaching. So just again, putting it in context with a long history at University of Kansas Medical Center with telehealthy lifestyle. For many years, there's been telemedicine services around healthy lifestyle. Some of those early interventions were really led by Dr. Adrienne Baxter with some supports and healthy lifestyle guidance for patients with diabetes. And then building on that, our Telehealth Rock Schools interventions with both feeding and pediatric obesity healthy lifestyle interventions to the school setting. There's also been a number of distance education approaches for healthy lifestyle with the Midwest Cancer Alliance, for example, leading kitchen therapy over telehealth and delivering healthy cooking classes around healthy lifestyle to sites throughout the state. That's a especially fun example where not only did folks be able to observe with telehealth the industrial kitchen at the Midwest Cancer Alliance, but some of the rural sites also cooking some of the same recipes so participants could test those. Anyway, I think a long story short, if you can think of a healthy lifestyle intervention, it really is a natural then to think about how can we use the technology to extend that. We see a number of other research projects at the medical center looking at healthy lifestyle, including an adult obesity project with Repower and Dr. Beffert, looking at weight loss and healthy lifestyle with breast cancer with Drs. Beffert and Klemp, looking at healthy schools with Dr. Davis, looking at using the technologies with pregnant and parenting teens, and then finally looking at healthy lifestyle and supports with parents of children with diabetes. So that just kind of gives you a context, and we'll hear next from Maggie about the varied technology approaches with iAmHealthy.
Yes, so as Dr. Nelson mentioned, I'm going to be talking about some technology specifically related to a study that we're both currently working on, and look at a few additional ways to promote a healthier home. But first, there are some very important people I'd like to acknowledge, including Dr. Nelson. So I'm very thankful to be part of such a wonderful team. The Center for Children's Healthy Lifestyles and Nutrition is a resource that Dr. Nelson and I are both members of, and it's a collaboration between Children's Mercy Kansas City and the University of Kansas Medical Center. And I actually started working there during my second year of grad school when I got the opportunity to work with kids with autism to promote healthier lifestyles. And that this has led me to the work that I'm doing now with kids in rural areas in Kansas. So they have a lot of features at the center, as it's abbreviated, that help to support their research, including a machine to measure indirect calorimetry. They have one to measure VO2 max, one to measure body fat called DEXA, so just to name a few, but all enabling very precise research results. And they do have a number of studies being conducted right now. There's a lot of research going on at the center, including research around physical activity, nutrition, physiology, cognition, and behavior, with the overarching goal of contributing new information to make kids' lives healthier. And we do know that these healthy lifestyles start at a very young age. And it is amazing the technology that the youngest generation is being brought up with. So whether that's computer or tablets or their parents' phones, but it's definitely the way of the future. So our goal is to use technology in a positive and a healthy way. A little bit about the study that Eve-Lynn and I are working on right now. It's called iAmHealthy, and we work with kids between 2nd through 4th grade in rural areas of Kansas. We actually recruit school personnel, so workers at a school. It's typically nurses, but we also have some PE teachers. We have a 2nd grade teacher. We've worked with several principals, but these school personnel are the ones who recruit around 10 kids from their school who are between the 85th to 99th percentile for BMI, so this puts them at the overweight or obese category. And once we have everyone recruited for our school, they are randomized into either an iPad group or what is also our intervention group, or they're randomized into a newsletter group or our active control group. In the iPad group meets, as you can probably infer, over iPads throughout the intervention, and this intervention lasts for 8 months. And the newsletter group also receives the same information as the iPad group does, but it's in the format of a newsletter. So these newsletters are sent out once a month for this same 8-month period of time. And you can see an example of one of, at least the front page of one of our newsletters on the right side of the screen. But the overall purpose of our study is to compare our iPad group or our iAmHealthy group to our control group or our newsletter group. We are currently finishing up year 2 of 3 of our study, and we've worked with schools all over the state of Kansas. We've worked with a couple out in western Kansas, several in central Kansas, one that we're working with now in southeast Kansas, and 3 that are not too far from where we are located here in Kansas City. So let's talk a little bit about how technology has transformed in our research over the last decade. We completed our pilot study about 10 years ago, and all of the parents and kids came to their school for their group sessions. So we had a webcam and a speaker system that was set up at the school, which was actually pretty sophisticated for that time. But with advances, we've moved to where every family receives their own iPad, and they now join from their own homes. So we have group sessions where all of our parents and kids join using Zoom, exactly what we're doing now, at the same day and time for those group sessions. And we found that this platform has really worked well because everyone is able to see each other and the group leader, and it allows families to interact and discuss while once again joining from their own home. We've also found that for many, their homes are not located near the school, even though they're in the same community. So it helps to really reduce with transportation as well. For those randomized to our iPad group, we have 14 total group sessions that are throughout an 8-month period, with the first couple months being the most intensive. For those first 8 sessions, we meet weekly. Then we go to monthly check-in sessions. So in addition to these group sessions, we also have health coaching sessions where the families meet individually. And these are really helpful because they help to build relationships with each of the families. And that can be kind of hard to do during those group sessions, especially for families or for kids who may be a little bit more shy or not as talkative. So we're really able to build rapport doing this. And we can discuss things on a more personal basis, look at their successes and challenges a little bit more closely, help to problem solve, but once again, more on a personal level. But our overall goal for contact hours, we're hoping to meet throughout this 8-month intervention, the guidelines set by the United States Preventive Services Task Force. So this is 25 hours throughout these 8 months. Listed here are the topics that we discuss at each of our group sessions. And once again, the first 8 group sessions are occurring weekly, and the final 6 group sessions occur monthly. In the first group session, we talk about goal setting, which is really the foundation for the rest of our group sessions. We have both parents and kids set goals at the end of each of our group sessions that really dictate what they want to focus on until the next group session. So from there, we talk about a variety of different topics listed here, things focusing on nutrition, physical activity, sleep, information dealing with stress or problem solving. We also look at some behavioral change like praising and ignoring and incentives. But our hope is to give families a well-balanced view of what a healthy lifestyle looks like. This slide is a bit overwhelming, but I do want to touch on our aims for the study. We're seeing if the iAmHealthy program is effective compared to our newsletter group, but it can be a little bit more challenging to understand how exactly we're measuring this effectiveness. So our primary aims are for that hypothesis 1A, diet. We're looking at sugar-sweetened beverages, red foods, which I'll touch on more in just a bit, and the servings of fruits and vegetables each day. For physical activity, we're looking at moderate and vigorous physical activity. And when looking at weight, we are focusing on BMI-Z for kids and BMI for parents. Now, our secondary aims are looking at the implementation and the sustainability of iAmHealthy, and we use the RE-AIM framework for seeing if we meet these aims. So this is essentially looking at how well our research is being translated into action. We have 3 time points to gather measures, and I'll talk about these measures more in the next few slides. But the first time point is at baseline before schools have been randomized. And after they complete these measures, they're randomly assigned to either the iPad group or the newsletter group. And both of those groups last a total of 8 months. And after these groups have finished, we have our second time point. And then our final time point is at 20 months to see how well any changes have been sustained. The first measure the families complete at each timeline is online questionnaires. And these are completed on our web-based application called REDCap. And they complete questionnaires on a number of different topics. These include demographics, food insecurity, stigma, bullying, any psychological distress, so really quite the array. Our second measure is diet recalls. For these diet recalls, we have our trained staff contact our families and ask that the parents track everything that their child has to eat and drink for 3 days. And this is 2 weekdays and 1 weekend day. From there, we call the parents either the evening after they have tracked. So we call them on 3 different occasions for each of their 3 days, either in the evening or the following day of each of these days that they've tracked. And in addition to talking with them about what their child had to eat and drink, we also have them take pictures of as many meals, snacks, and beverages as they can. And we found this to be beneficial for a couple of reasons, really. The first is it's an image for the parents to see what exactly their kids are eating, and it also serves as a reminder. But secondly, when we're going through the day with them, it allows us to have a visual to make sure that the amounts that they're reporting seem to be accurate, and it gives us some ideas for follow-up questions. So for example, this toast right here, we can see that it's plain, but when we have a visual of that, it might prompt us to ask about if any additional spreads were added to that. Once we receive this information for these days, it's entered into NDSR, or Nutrition Data System for Research, where it is then analyzed, and it gives us a very, very detailed analysis of anything that you could want to know about it. The final measure we look at is physical activity, and we use activity tracker devices called Actigraph, and this device is worn on a belt around the child's waist. In this picture shown here, the device is on the outside of their clothing, but it's typically worn underneath their clothing, so most of the time you aren't able to even see it or notice that a child's wearing it. And the kids wear these all day for 7 days, except for when they're sleeping and or when they're showering or in a pool. They are able to wear it if they're sweating, but they also keep track of their wear time on an activity monitor tracking log. The activity monitor software generates a report that looks like this, which the participants receive. And the text is very small, so I'm going to make sure that you all can read it okay. On the x-axis, we have from midnight to midnight on one of these days. And then along the y-axis, we have sedentary activity. So this would be things like sleep or watching TV. We have light activity. Next, we have moderate activity here. And this upper tier isn't labeled, but this is our vigorous activity. And what we hope to see in these reports is a lot of spikes in this moderate and vigorous range. So these reports are for 2 different kids, and the top child is one who struggles with activity. So the activity is really an area that we're focusing a lot with, especially on health coaching, but as well as at group sessions. So for example, he reached moderate and vigorous physical activity for 20 minutes. This second child is actually in the same group, but he is one of our most active children in our study, and he had right under 2 hours of moderate to vigorous physical activity for this day. So it really helps them to have a good visual of when they're getting activity and areas to improve as well. So let's look at some specific topics that we discussed during the group call. First, we have the stoplight diet, where we categorize foods into either green, yellow, or red foods. And the way that we define these categories are green foods are any plain fruits and vegetables. Once any, say, butter or sugar is added onto fruits and vegetables, they no longer are red foods. For our yellow foods, these are foods with less than 7 grams of total fat and less than 12 grams of total sugar. And these are our foods that we kind of say are not bad, but we want to watch portion sizes a little bit with these. Our green foods are foods that we say eat as much as you want. And then red foods are foods with over 7 grams of total fat or over 12 grams of total sugar. So many of our families aren't aware of nutrition labels or eat out frequently, 3 or 4 times a week. So the stoplight diet is really a great place for them to start to understand nutrition and what exactly is in foods. On Zoom, exactly what we're doing now, we share our screen and we go over nutrition labels with the families so that they can get a lot of examples, and this repetition really helps to help them, the information kind of sink in. So for example, we have our oatmeal here that has 1.5 grams of fat and 6 grams of sugar and would therefore be categorized into a yellow food. Now they could go to the store and see if their regular oatmeal that they typically get, if that is a red food, and if so, then we would recommend them swapping that red food for a yellow food. So it really helps when comparing foods as well. Another convenient thing about being in families' homes throughout these sessions is that we can see things through their eyes. So, for example, we send families at the beginning some stickers that are green, yellow, and red, and we do an activity called Clean Out Their Cabinets, where they label each of the foods in their pantry and in their fridge with green, yellow, or red stickers, which is a great visual for parents and kids, and also helps them to ideally clean out those red foods in their house. So we can actually, during our health coaching sessions, have them hold the iPad up to their cupboard. We can look at nutrition labels with them and make recommendations from there. We have a couple activities on portion sizes, and we do this once again by sharing a PowerPoint presentation on Zoom, and we go through these slides with their family. We use a lot of the wonderful features of Zoom, but this activity really helps to put things into perspective. So how we do this is we talk about portions from a couple decades ago, and for example, these fries from 20 years ago had 210 calories, and from there we have the families guess how many calories are in this bucket of fries, which happens to be 610 calories. Now, to make this more applicable, we connect it with an activity. So for example, if it would take 1 hour and 10 minutes to burn off this extra 400 calories from this bucket of fries versus the sleeve of fries. And the kids also enjoy this too because very interactive, and they're able to guess, which is always a fun time. The second activity we do around portion sizes involves kids physically going to their kitchen and pouring out a amount of a snack that is normal for them. So we have them look at the nutrition label and see how many servings are in that portion, and compare to others in the group as well. And this activity is always a little bit shocking, but something that kids remember often. So, for example, one thing that I was talking about actually just last week with one of my families is I was asking the child if she could remember the information that we discussed in the group session. And she said, I can't remember what we talked about, but I can remember what we did. So by using this technology to bring the group to their house, the kids are more likely to apply it to their everyday life. To help kids and parents understand nutrient density, or the proportion of vitamins and minerals in a food, we use a website called Chronometer or Chronometer. I've heard it pronounced both ways, but they can input their foods and beverages and see how this adds to their micronutrients and their macronutrients for the day. And this is something that we can also do during the group or health coaching sessions to go through and physically put in, what one of the children had for the day, and see how these totals add up. And the primary goal of this activity is to see how what foods, in a sense, give them the most bang for their buck when it comes to those vitamins and nutrients. Now, looking at a few observations we've come across by using iPads, we're seeing things from a very different perspective sometimes. We often have families' animals come on screen with them. So in addition to cats and dogs, I've also had ducks or pigs, horses. I had a guinea pig come on last week. So you kind of get to see what home looks and what their normal looks like as well, and that's always kind of fun. We also have a lot of siblings who will pop up for a few minutes. We have some who will stay the entire session as well. So it promotes the entire family to make these healthy changes and really get involved with this. We're finding that families are very, very busy as well and have trouble fitting our sessions into their busy schedules. So they'll call in from some surprising locations. We've had people call in from cars, and cars that are not moving. They are, say, at a brother or sister's baseball game, and the mom and the son will go to the car and join in from there. We've had people call in from a nail salon, department store, a pool. So as long as it's private and it's secluded, we are able to continue as normal. Another great thing about technology is we've had excellent retention. So 100% of our newsletter families and 95% of our iPad families have stayed in the study. Now let's take a look at some of the other ways that we use technology in iAmHealthy. First, we've created a website for interested study school personnel and families where they can come and visit to get more information about the study, to find out a little bit more about our team, and they are able to contact us from this as well. We've created a Facebook page. So this actually came from a suggestion from one of our families in our first cohort. And it was really intended as a way to connect with other families from their school. So in addition to the public page, which is shown here, we have private Facebook groups for each of our schools where parents can post like pictures or videos of their kids completing any goals, or they can, recently we've had a lot of really great grilled vegetables that have been posted. They can ask any questions to other families. They can also offer suggestions. So if there's a cool event going on in the community, or if there's a farmer's market that is, say, on Saturdays, they can post that information there as well. Before we send out our iPads, we are able to image them with our content, and this includes some free apps. So we're going to take a look at a few of those now. Strides is a really wonderful app because you're able to customize any goal, whether that's physical activity, whether it's something related to diet like fruits and vegetables, sleep, praising, the list really does go on and on. And another cool feature about Strides is it sends you a reminder throughout the day and displays a chart to show your progress and to really keep you motivated as well. MyFitnessPal is one of our more commonly used apps and commonly known apps for our families, but this is really wonderful for those who have trouble tracking. It's kind of a one-stop shop for anything that you would need to know about nutrition, and it is really a great first exposure for families who may not have that nutrition knowledge, so they can have a better idea about what exactly they're putting into their bodies. It also is a great resource because it has a number of new recipes, and it has an online community which several of our families have taken advantage of. Fat Nanny has been one of our kids' favorite apps because it reminds, well, first off, it's darling, but it reminds our kids to drink water regularly. So one thing that we really stress with this water intake is that while they're increasing their water intake, that they're really decreasing their sugar, sweetened beverages, and substituting this for water. As kids drink water throughout the day, their plants are growing, and they can get a wonderful visual of this, which serves as a great motivator as well. Go Noodle Kids is another one of our kids' favorite apps. We do have a number of those, but it turns screen time into active time, and it has a lot of different routines. It has different skill levels. It has different age groups. So something that it's one that's more familiar with our kids, especially because we're finding that it is used in a number of their schools, but they always really love to scroll through and find an activity to do in Go Noodle. Eat and Move OhMattik is an app that was actually created by 4-H, and it helps kids to understand energy balance a little bit better. So this is the difference between the calories that we're putting into our bodies versus the calories that we're burning. So we choose, it has a place for you to scroll, and you can choose from a long list of foods and a long list of activities and see how they balance out. An example here is that it takes 39 minutes to dance off 4 cups of popcorn, where on the other hand, it would take almost 2 hours to dance off a serving of large fries. There are some more sedentary activities on the app as well. So it would take almost 7 hours to burn off the same large fries by watching TV. The final app we're going to take a look at is Virtual Hope Box, and this helps people with coping and relaxation, distraction, and positive thinking, and is an excellent app to help with mental health. Now, for our families who aren't as tech savvy, we've uploaded worksheets that they can edit on their iPad, or they're able to print them off and complete them with pen and paper. So we have here our weekly goal sheet, which we ask families to complete. We also have a screen time tracking log. So our hope is that families really do find something that works for them, whether it is an app or a website, or whether it's just old-fashioned method of pen and paper. One change that we've introduced with this last cohort is that every child and parent who doesn't already have a device to track their physical activity receives a Garmin device. This is what the kids app looks like here. And these have been really wonderful because it puts a number on activity. So for example, I was working with a family about a month ago, and it had been kind of a lazy Saturday, and they were able to see that they had only gotten 2,000 steps that day when they are typically getting 8,000 or 9,000 steps a day. So it makes it a little bit more tangible than just looking at screen time or looking at like if they're going outside. So it has served as a wonderful motivator for a number of our kids. The parents receive a Garmin Vivofit that looks like this, and one of the neat things about the parents having these Garmins is that we're actually able to connect with them on the Garmin app that was produced. So we can see their steps and their activity. Now, we're unable to do this with kids because of privacy policies, but we are able to connect with our parents. And we have found that it encourages parents as well. And we have, I'm thinking of one family in particular where the parent and the child compete with each other to see who can get more steps throughout the day. So this has been a wonderful encourager as well. Oops. Since a 1-hour session is fairly long for kids, we have included Energizers, what we call, in our sessions to help keep them engaged and to get them moving as well. So these Energizers are several minute spurts of activity in the middle of the group sessions to kind of get them up and moving. So I don't think it seems right, the fact that we're talking about all of these healthy lifestyles and ways to use technology and not allow you all to experience what our families experience. So we're going to take a couple minutes and do some movements from our own chair. So this video is from Mayo Clinic, and they call these desk-ercise.
Hi, I'm Christine Ely, Employee Health Promotion Coordinator at Mayo Clinic, Arizona. Today we're going to demonstrate some stretches that are going to help reduce stress and tension in your lower back and your torso. To stretch your upper back and side, interlace your fingers, lift your arms straight up over your head, and slowly bend to the side, feeling the stretch. Come back up to center and stretch to the other side. To stretch your torso, you can do a seated twist. First, sit up straight, keeping your hips stationary. Twist all the way from your lower back all the way up to your head by looking over your shoulder. You can grab onto the armrest or the back of the chair while stretching. Relax, slowly return to the starting position, and repeat on the other side. To stretch your lower back, sit upright in your chair. Bring one of your knees towards your chest. Use your hands to grab the back of your thigh and gently pull it toward you. Keep your back straight, being careful not to lean forward. Hold the stretch for 30 seconds. You should feel tension in your lower back and the upper part of your buttock. Relax and slowly return to the starting position. Repeat the stretch with the other leg. To stretch out your hips, while sitting, cross one ankle over the knee on the other leg. Sit up tall and gently lean forward. Relax and slowly return to the starting position. Repeat the stretch with the other hip.
All right, so that is the end of the information that I was going to cover. So I do have my email address and our study email address listed here. So please let me know if you have any questions, but we would also definitely take any questions that you have over Zoom that Dr. Nelson and I would be happy to answer.
Thank you, Maggie. That was great. I especially loved the desk exercises. That was wonderful. One of our questions is, it doesn't seem that Northwest Kansas is represented here. Do you have any plans to include some of those cities or towns also?
Yes, that is a great question. I know we would love to have a better representation of Kansas, and we were planning to work with Goodland, but there were some logistics issues that didn't allow them, just scheduling. So if anyone does have any recommendations of schools, we are currently looking for schools where we have most of our slots filled, but we are looking for a couple more. So if you do have any ideas or any contacts, definitely send them my way, because we would be happy to start that communication.
Great. Are there any other questions? All right. Well, not seeing any. I just want to thank you both for this wonderful presentation. I believe that people had to have received a lot of good information from this presentation, and we so appreciate you being able to share that. All right, so now I'm going to share my screen again and just give you an idea of what's coming up next in our webinar series. August 6th is our next webinar. It will be the Telehealth Technology Showcase. And also on the calendar is July 18th for the National Consortium of Telehealth Resource Centers webinar on an overview of cybersecurity. Speaker will be Jordan Berg from the National Telehealth Technology Assessment Resource Center. If you would like to register for that, please go to telehealthresourcecenter.org for that registration. If you have any questions, please let me know. My email is on this particular slide, and you may certainly provide me with any suggestions on future topics that you would like to see on this webinar series as well. So again, thank you for participating in this webinar. This concludes our webinar, and we certainly look forward to seeing you next month. Have a great rest of your day and a great 4th of July. Thanks so much. Bye.